Good morning, residents of Carroll Lutheran Village. My name is Ty. I am from HomeCall. I'm the executive director. I'm a nurse, registered nurse by profession, and also a certified nurse practitioner. And I have here my clinical director, Michelle Addison.
Hello, residents of Carroll Lutheran Village. I'm Michelle Addison. I'm a registered nurse as well with HomeCall Westminster. And I'm also the clinical director.
So we're here to talk about HomeCall. What is HomeCall and why do residents need HomeCall? HomeCall offers patients medical services in their own home. We provide skilled nursing care, physical therapy, occupational therapy, speech therapy, social work, and home health aid services as well. With HomeCall, we partner up with your medical director, Dr. Bass, to see those patients and those residents that need our help. We come from a 5-star rating with the national CMS average. So what does that mean for you? It means that we keep our patients out of the hospital. Chance of them rehabbing back to a baseline to be as independent as possible is very high. So I look at it like we go into a 5-star restaurant. That's what HomeCall offers, 5-star quality of care. Our focus is to make sure the patients stay out of the hospital, so that rehospitalization rate that is so high, we make sure we do everything we can to keep you at home, comfortable with your loved ones, and to be able to perform your daily care.
Yes. So we're HomeCall Services. Here's what we have to offer you. Our services are covered by your insurance, mainly Medicare or private insurance. So if you're worried about costs, you can put your mind at ease that this is covered by your insurance. Which also we partner with your doctor, your medical doctor. She mentioned Dr. Abbas, but also your primary care physician. So we operate under the auspices of your doctor, and that requires an order. So we will come out to provide services that are delegated or relegated by your doctor. Medicare requires that the patient is at home. And what does that mean for you? It doesn't mean that you're not allowed to leave your home. It just means that you're only allowed to leave your home under certain circumstances. And that is really to keep you safe and for us to maintain our continuity of care. So you should be home or homebound. In your home, and what does that look like? It just means that it's a taxing effort for you to leave the home, and that means that you require the presence of another person, maybe your child or your spouse or someone at Carroll Lutheran Village to help you or assist you out of your home to be able to maintain your medical treatment and care. It also means that you require an assistive device or something of that sort to be able to leave your home. Okay.
I have a question for you, Michelle.
Yes.
So when you talk about home health, what is the difference? Because I know a lot of people get home health and home care mixed up. So can we talk about the difference between that?
Yes, that's a great question, Ty. So home health and home care, they differ, but they kind of walk hand in hand, but here's where they differ. With home care, it's more private duty services. It is led by you. You get to choose what you want for that particular service. And usually the home care, they're in your home for several hours of the day, providing unskilled services, meaning that you don't require a doctor's order. With home health, you require a doctor's order and it is covered under your insurance, whereas home care is not covered by your insurance. So we walk hand in hand with your doctor. We partner with your doctor to provide you services in your home. That's what home health is.
Thank you so much for elaborating on that. So another question some people will have, why do we need home call services? I like to talk about what we present, what we can offer and present to future clients out there. We really focus on any patients that have any new exacerbations or existing disease. If you go into the hospital who's recently diagnosed with anything, home call can come out and help educate you on that and how to stay out of the hospital and how to live daily with your new diagnosis. Any new changes of medications, even with the current diagnosis, and you need that help. I can give an example, our diabetes patients, just newly diagnosed with diabetes, and so that can be very difficult to handle and manage. So we come in to help assist you or your loved ones on managing that medication so you have the proper education, and our goal is for you to stay out of the hospital with that. If you've had any multiple multiple hospitalizations within the past year, or recent hospitalization in and out, we come in to help you with that. Again, because we're on a national average, we're 7%. So our goal is to make sure we educate you and your family on how to stay out of the hospital by calling us first, having us come out and assess the situation, and to tell you what the next thing to do alongside with your primary care physician. If you find yourself going into your doctor's office multiple times because of many issues, again, we can come in and help you with that, with education, management, with the disease process. Any recent falls at all, or multiple mobility problems, just having issues with incontinent or bowel issues, that's something that we can help you with. Also, vision problems as well. We have everything that we can offer you, every discipline that we offer, nursing, PT, OT, and speech, home health aid, we all come together to help you with some of these issues. Again, the goal is to make sure you're at home, you're safe, and you stay out of the hospital. That's our major goal at HomeCall.
That's good, Ty. Thank you so much. I'd like to also point out, it seems like you guys are, or at HomeCall, we're focused on the whole person rather than just the disease process. I heard you mention about physical therapy, occupational therapy, and I also heard you mention about the 7% rehospitalization, meaning that your risk of going back into the hospital is extremely low at 7%. So that's really good. I also would like to touch on some of the programs that we have to offer at HomeCall that assist with those new diagnoses and recent falls that Ty mentioned. There are programs that we have established and in place that will assist you with, if you've had a recent fall, how to remain active and how to reduce your risk of falls. We educate you on fall prevention. We also have an active life balance program with our physical therapy department, and that program helps to increase your strength and your endurance, and that will ultimately reduce your risk of falls. We also, Ty mentioned about low vision for those patients who have vision problems or vision changes as they grow older. With low vision, it increases your risk of falls. So we have a program to help you with that as well. Of course, we're not going to bring back your vision, but what we can do is offer you programs and assistance that will help you adapt to that new change in your vision, and will help to reduce falls and reduce your risk of going back into the hospital, as well as reducing your risk of injury due to the low vision. We also have a telemonitoring program, which I love, is one of my favorites. So that it's like an extra set of eyes and ears when the nurse or the physical therapist is not in the home. It just helps you feel a little bit more safe. You have someone contacting you if your vital signs are out of order. So it's just a little machine that assists you in your independence, because again, our goal is to help you maintain independence. We don't want to take your independence from you. We want you to maintain the independence that you have. And this telemonitoring program will help you with that. You're able to take your own vitals, your blood pressure, your pulse ox, your weight, your blood sugars. You're able to take your vitals, and we're able to monitor you remotely. So if there's a chance where you need the nurse to come out because something's out of whack, we're able to do that through that telemonitoring system. That's one of my personal favorites. We also have the pelvic floor therapy program. That program helps with incontinence that Todd mentioned about. Sometimes as we grow older, our bladder becomes weaker, and we need assistance with maintaining, what strength we have. So we do have a pelvic floor therapy program to reduce your risk of incontinence and thereby reduce your risk of fall, infection, and rehospitalization.
And also, there's a new program that we just rolled out. It's called the HomeCall Respiratory Recovery. We all know now that we're in the middle of a pandemic, and this is something that was very scary to us. So we had to put together a program that will help our patients with this disease and help them recover, because that's the goal, is for them to recover and to be able to be as independent as possible. Our respiratory recovery program, it helps with patients with COPD, asthma, recovering from COVID-19, anyone that's requiring any oxygen, any patient that was diagnosed with pneumonia, or any recent medical ventilation. So we focus on your breathing and making sure that we help strengthen your breathing so you can be able to be, of course, as independent and stable as possible. During this last year, many patients have been isolated due to COVID-19. According to the National Scientist Report regarding the effects of social isolation during this COVID-19 pandemic, patients who exhibit signs of isolation and loneliness show 50% increase risk of developing dementia, 59% increased risk of functional decline, 29% increased risk of incident coronary artery disease, 25% increased risk of cancer mortality, and 32% increased risk of stroke. This is something that has been out there, and we focus on making sure that we touch every aspect of our patient's life and to help them, again, rehab and be as some sort of independence as possible. Our goal is your goal. And once you meet your goal, we have done everything we have in home health. So I want to thank you guys for taking the time out to sit with myself and Michelle today. Again, HomeCall goal is to provide quality home health services and keep our patients independent and safe at home. And if you have any additional information or any questions on setting up HomeCall services, please reach out to our Westminster office at 410-848-5379, and we will be happy to help you. Thank you guys.
Thank you so much.
Bye-bye.
Bye-bye.